Here I show you a low-bend angle between nail and nail bed, which is less than or equal to 160 degree in case of normal. In clubbing, angle is more than 160 degree. Here there is a normal angle. Now I am going to show you Samroth sign. In Samroth sign, we have to open two like this way, and there is a creation of diamond shaped space. So this is a negative Samroth sign. In case of clubbing, space is disappeared and obliterated, and that is positive sign.
I am Martin George, working with Gujarat Adani Institute of Medical Sciences, Bhuj. I am with Adani Group for last 16 years. I am basically a heart patient, VSD by birth, non-operatable. My ventricles cannot be operated. That structure is like that. The doctors say that it's very complicated to do that. And means twice I had brain abscess due to this one. I have been operated at Rajasthan Hospital both times. First instance I was in 2002 December. I got totally paralyzed. God willing, I am walking again. Second, the brain abscess was in May 2011. I was giving my CA final exams. I collapsed in the exam hall itself. Then after that I was taken to Rajasthan Sterling Hospital. Dr. Parimal Tripathi did my operation and I was healthy again. I am back to work. Basically, since a VSD patient, I was totally on drugs. My father was in defense, so we kept on moving one place to another, and my entire medication was in defense hospitals only. Then I was taking Panadier on a monthly basis. Once during 1989, I had Panadier in reaction, and I had been experiencing cardiac arrest I think 3 to 4 times, and that was through with that, and again entirely that I was back to school, and again did my graduation and CA intermediate, and then working ever since that one. And every time I visit a doctor, they were curious to know about me, so they take every test free of cost, and I don't have any problems on that one. Particularly my nails, you can.
Hello everyone, myself Dr. Nilesh Goswami. I am working as an assistant professor in Gujarat Adani Institute of Medical Sciences, Bhuj. Here I am discussing a clinical sign called clubbing. Clubbing is a proliferation of the soft tissue with fluid retention because of vasodilatation and hypoxia. Clubbing is also known as a Hippocratic fingers because the sign is demonstrated first by Hippocrates. So because of his name, clubbing is also called Hippocratic fingers. Also called drumstick fingers because of the appearance of the fingers. Then there are numerous causes related to development of clinical sign clubbing. First, cardiovascular causes. In cardiovascular causes, main is tetralogy of Fallot, transposition of great vessels, VSD. In VSD in later case is developed into right to left shunt, and then development of clubbing. Then pulmonary causes. In pulmonary causes, commonly seen bronchiectasis and lung abscess. In also interstitial lung disease like fibrosis and carcinoma of lung also related with development of clubbing. Other causes include gastrointestinal system disease, Crohn's disease, ulcerative colitis, malabsorption syndrome, all related to development of clubbing. In some minor disease like Graves' disease, autoimmune disease, and congenital formation. Congenital formation include it either may be autosomal dominant or autosomal recessive and mainly involve thumb. Then we are discuss grading of clubbing. Then what are the grading? There are 5 gradings. In grade 1 there is a softening of the nail bed because of the proliferation and retention of the fluid, which lead to softening of the soft tissue and nail bed. Then grade 2. Grade 2 is a obliteration of the lower bone angle. Then grade 3. Grade 3 is a development of peacock beak appearance. Because of the proliferation, there is a appearance of the finger and nail bed is like a peacock bed. ठीक. Then for grade 4 is drumstick appearance. The appearance because of the proliferation, appearance of the fingers become like a stick of drum. Then grade 5 is a hypertrophic arthropathy, osteoarthropathy. In this case, there is a proliferation of the bones of distal phalanx, and this lead to swelling and proliferation of distal phalanx. This lead to development of proliferative osteoarthropathy, which is commonly seen in X-ray. So this is a patient which have a disease ventricular septal defect. In later case, because of the ventricular septal defect, there is a development of pulmonary hypertension, and because of the pulmonary hypertension, development of right to left shunt occur, and because of right to left shunt, there is a hypoxia, and this hypoxia is responsible for development of the clinical sign called clubbing in this case. So here we can see how clubbing is there. Semrod sign is also positive in this case. You can see easily how there is a, I think here it is a grade 4 type of clubbing. You can see. Thank you.